Welcome to the European Parliamentary Research Service podcasts.
Today, we'll be talking about the rise of digital health technologies during the pandemic. We'll look at their potential to improve our health systems and services, but also at challenges linked to data privacy, accessibility, liability, and cybersecurity, among others. Keep listening.
Doctors using telemedicine to diagnose remotely, patients logging their symptoms into specially developed apps to assess the likelihood of infection, contact tracing apps.
There's no doubt digital technologies have become critical in the fight against COVID-19. But what are digital health technologies exactly?
Well, digital health is a very broad concept that includes solutions for telemedicine and teleconsultation, remote monitoring, connected devices, digital health platforms, and health apps. It also covers the related health data analysis and application in systems based on big data, for instance, for epidemiological research or diagnosis supported by artificial intelligence.
Digital health technologies are not new, but the coronavirus has accelerated its development and use. Since the pandemic began, 58% of countries have been using telemedicine to replace face-to-face consultations.
This has helped hospitals and general practitioners restrict face-to-face contact to essential visits, but it has also allowed doctors to collect new data from their patients and provide new services.
For instance, thanks to teleconsultations, doctors could identify potential lifestyle factors in illness, such as poor nutrition. And while in video conference with elderly patients, they could monitor the background for tripping hazards, saving them from further trouble.
In addition, most EU member states have launched national contact tracing and warning apps to prevent the spread of the virus. And thanks to digital technologies, scientists around the world could quickly share information and scientific discoveries about how the virus operates and spreads,
which allowed governments to put in place containment measures, hospitals to devise more effective cures, and vaccine developers to come up with effective vaccines in record time.
Digital technologies have also enabled the European Union to set up its own COVID-19 data platform for collecting and sharing research data to beat the coronavirus and prepare for future outbreaks.
And should it finally be approved, the EU Digital Green Pass will allow citizens to start moving safely inside the EU again. Let's hear Commission President Ursula von der Leyen.
What is the function of this certificate? It shows or states whether the person has either been vaccinated or a recent negative test or has recovered from COVID and thus antibodies. Secondly, the certificate will make sure that the results are mutually recognized in every member state. And thirdly, with this digital certificate, we aim to help member states reinstate the freedom of movement in a safe, responsible and trusted manner.
What's clear is that digital health is here to stay.
Yes, it is. And with the advancement of 5G and the Internet of Things, real-time applications that would not work properly with the current 4G technology, such as remote or robot-led surgeries, are expected to boom.
Artificial intelligence solutions are already being used to help healthcare systems handle increasing demand with limited resources, supporting scientific research, personalised medicine, early diagnosis of diseases such as cancer, and adjusting patients' treatments.
So, logically, European health startups using artificial intelligence are booming, and the market for artificial intelligence in healthcare is expected to reach €5.5 billion by the end of the year. But there are challenges to overcome, as advances in digitalisation of healthcare come with drawbacks.
First of all, digital health solutions such as telemedicine based on 5G will require massive investment to build new infrastructure.
If digital health is to be inclusive and accessible to all, Europe will also need to address the widening digital divide that risks leaving behind the elderly and socially disadvantaged who are less able to master or afford the technology, as well as people living in rural areas. Peter Varney is an expert in future digital health services from the Technopolis Group, regularly advising EU institutions on this topic.
The issue around digitalization of healthcare is also about social inclusion and equity of the access to these services. And we have seen that having the physical infrastructure is only one step, having the digital literacy the other. So we have obviously more challenges in the rural aging environment to actually exploit the potential of digital health services.
In terms of liability, many questions remain regarding who is to be blamed if digital systems go wrong. And then there's the question of privacy and data protection.
The transfer of massive amounts of often very private health data is fueling a debate over who owns and controls that data: the patient, the healthcare provider, the state, or the companies that collect it, raising questions over individuals' rights to privacy.
In addition, cybersecurity issues need to be considered as cyber attacks on hospitals are on the rise.
Good point. So, what is the EU doing to promote digital health?
Well, the EU has been supporting the e-health developments for many years, and the 2018 plan for the digital transformation of health and care includes measures to empower citizens to access and share their own electronic health records and to pool data across Europe in order to boost research and bring personalised medicine one step closer to citizens.
To achieve this, the EU is putting more money into digital health while trying to find solutions to the many challenges we've outlined in this podcast.
The pandemic has provided a clear momentum for the rise of digital health technologies. Now it needs to be continued.
This is a European Parliamentary Research Service podcast.
Thanks for listening.